Well, the top symptoms for COVID are changing. At first, it was the loss of taste, smell, and high fever.
And now the indicators are like what the president is experiencing: a runny nose, fatigue, also a sore throat. Eyewitness News anchor Siafa Lewis spoke with a local doctor about the shift in symptoms and the subvariant that they are connected to.
Yeah. Good evening, Jessica and Yuki. Even before today's news of President Biden testing positive for COVID, the virus had once again reminded us of its presence with an increase in cases in many corners of the country the last 2 to 3 weeks. This time, it's not 2021's Delta variant or last winter's Omicron variant wreaking havoc. It's a subvariant of Omicron named BA.5.
Viruses, what they do is they mutate, they change, right? So there was BA.1, there's BA.4, BA.5. BA.5 is like, think of a family, the Omicron family. This is the family member right now that is causing majority of COVID infections in our country.
According to the CDC, the BA.5 subvariant is currently responsible for roughly 78% of the country's COVID infections, and it may be the most contagious strain of the virus yet. But that's not all. The symptoms for BA.5 are a little different than with Delta or the first form of Omicron.
BA.5 tends to be more in the upper respiratory system. Cold, hoarseness, cough, runny nose, congestion. These are very common symptoms of BA.5.
As with prior variants and subvariants, fatigue is also a common symptom, though with this version, many find it difficult to fall asleep. That said, the news isn't all bad.
The good news is, for those who are vaccinated especially, this tends to be a milder illness. It should go away in 2, 3, 4, 5 days. For those who are not vaccinated, those sometimes have more significant symptoms, for sure.
And as we navigate life with COVID, the doctor has some advice for us all.
My thing is, live your life, know your risk factors. If you're going to an area that's very crowded, you don't know the people, you have health conditions, you may want to wear a mask or make sure you're vaccinated or take precautions.
Dr. Robb says vaccines are doing exactly what they're intended to do. That's decrease the severity of a COVID infection and largely preventing hospitalization and death. Siafa Lewis, CBS 3, Eyewitness News.
Siafa, thank you. And we are staying on top of the president's condition and the latest developments as we get new information on all of the COVID variants and subvariants.